All right.
Larry, we're on?
Yes.
Okay. All right, I see the 5 of us on, and I don't see any attendees at this moment. Well, good morning, everyone. It's 8:07. We'll call the meeting to order. Um, the first meeting on the agenda is the approval of the minutes, but we have right now, this is Deanna Diamore, Health Director for the City of Norwalk. We have Terry Quell, Board Member, and we have Norman Weinberger, also a Board Member on, and we have Lamont Daniels, our Chief of Community Services. So we don't have a quorum yet to approve the minutes. So I just want to go on to the next agenda item then. The next agenda is public participation, but I don't see anybody on. Larry, right? You don't see anybody?
No, there's no one from the
No
public.
one from the public. Okay. All right. So we'll move into our COVID-19 updates and discussion. So our latest case count for Norwalk is 1,984 positive cases, and we are seeing a decline in the number of positive cases if you look weekly. So in the beginning, when we were reporting the data, we were looking at every day and like what were the new cases, but then we realized that it tells a better story by looking at it week from week, and not just the week it was reported to us, but the week a specimen was collected. That's much more meaningful data. And so we are seeing a decline in the positive cases. So we are obviously really happy about that and seeing all the efforts that people have made and the positive impact that it has been making. But we also know that Connecticut has entered phase 1 of reopen, Connecticut and Norwalk, last week on May 20th. And so it's something we're going to be closely monitoring. It's continuing to look at all the cases and the hospitalizations to see if there's any change based on the reopening. The governor and the mayor, they want to do everything very carefully and slowly so we don't see a resurgence again. And so that's why things have been starting to open up on a limited basis. So I'm sure you know, the outdoor dining has begun in Connecticut. Under this first phase. The salons are going to be starting to open, hair and barber shops. They're going to be starting to open on, the governor has said, June 1st. And then the governor has also talked about phase 2 tentatively starting on June 20th. That's the target date they're looking at for phase 2. And for the next phase, they're looking at opening all the personal care services. So tattoo, tanning, all of those other that would fall under that category, the nail salons. I know people have been asking about that. And so really taking it stage by stage for where we are with things. But before I go into all that, I did want to mention, Dr. Weinberger, do you want to mention what you were saying about some of the modeling, saying how we have to be super careful because we don't want to see a worse, in the fall, a difference?
Even as we go on, right, the modeling says that by the end of the summer, by the end of July, we should have an additional almost 100,000 deaths. And if we don't really be very careful about doing the social distancing and wearing face masks, we're going to have a resurgence in the fall. And people are very concerned about that.
And so, yeah, that's why we have to be, the communications, the messaging, they're all going to have to continue. The personal protection, the masks, why they're so important. So thank you, Dr. Weinberger. So I wanted to talk about just the crisis funding that we've received from the CDC. So the CDC allocated money to the state health departments, and the state health department has come up with an allocation formula for the local health departments and districts in Connecticut. And so they've looked at a base funding, depending if you're a full-time or a part-time health department, and then they've allocated money based on the number of positive cases you've had in your jurisdiction. So this funding is meant from March 2020 to March 2021, and they've allocated $82,827 to the Norwalk Health Department to be used for overtime expenses, increases in hours, and part-time staff. You can use it for IT services, for if you need a laptop for a staff member who's working remotely, website. There's a whole list of different supplies that you need. Whole list of things. And so we have been and they've set up a reimbursement mechanism for it. So they're not giving us the money and saying, here, this is a grant. They're saying you can use it for these purposes, and then you have to spend it and then put in a reimbursement request to the state health department. So we've put in 2 reimbursement requests so far. We put in one from January through March that included extra time for our preparedness staff and some other equipment that we needed. And then we also put one in for April. So we're continuing to do that and putting in those requests, because it's a 100% match for what we spend. There's the FEMA reimbursement, which is separate, but we're trying to get get reimbursed through this mechanism, because this is for, it's available to us, obviously. So we are pursuing that funding, and other health departments are as well, to get reimbursement for expenses. Any questions on that?
Where does, going forward, the thing that's going to be very important is testing and following through with the testing. Where are we with that? Who's in charge? Who's involved? Where are we going with this?
Yeah, so the governor's office has a statewide testing strategy where they have different different segments based on the time frame and where they're focusing. So as you know, the testing so far has been really focused on those who are symptomatic, getting a test. So they have different populations that they really want to target moving forward. They're doing those point prevalence surveys of nursing homes. I don't know if you've heard about those for the residents, and then they're going to move beyond that to all the staff. So that's a big priority for them for testing. But then they're also looking at those who are at higher risk, and those who they're looking at increasing testing in certain communities where there's higher population. They're looking at seniors. They're looking at all different strategies. And so as a state, they've looked at, are you familiar with the CVS testing sites? They've had, the rapid testing site in New Haven, and they're also adding more drive-through testing. They've added a couple in Stamford. They've added one in Danbury. So they've had a goal they set a goal for 42,000 in a week, and they want to increase that. But we are, as a city, I want to look at also where we are in Norwalk. The hospital collection site has been phenomenal. They've been able to turn tests around really quickly, results really quickly. They've been a huge resource to Norwalk. They can return some tests within 24 to 48 hours. It's been really fast. So it's been a great resource. And then the community health centers are also a big part of the testing strategy moving forward. The state is working with certain, looking at different cities. So we know that Stamford and the other larger cities were in the first round of priorities for some of that more testing with the community health centers. And we know that Norwalk is in the second phase. So we've had discussions with our community health centers. We don't know exactly when that's going to happen. So I'm rambling a lot about the testing, but there are priorities that the governor has put together. So we're looking at that currently and just trying to get a sense of how is the testing going and what are the barriers for testing, because we want to be able to test anybody who with symptoms, but then also looking at asymptomatic people as well moving forward.
In that context, as they're talking about opening the schools and a lot of kids being asymptomatic carriers, where does that testing, has that been part of that discussion on what to do?
I haven't heard the discussion about this within the school, within targeting children for the testing.
Yeah, exactly. Children are never targeted for almost anything.
Have you heard that? Has that come up in any of the other cities? Have you heard of that?
I don't know yet. Tomorrow, I'm the advisor also in Westport. Tomorrow we're having, they have a whole bunch of committees, and I'm on the health committee, and I'm bringing it up there too.
Yeah.
Because I've actually heard nothing.
Yeah, I don't believe they're on the list of targeted populations from the state. So I also wanted to give some updates about just division by division, some of the activities. So I just wanted to give you some updates on like for the Public Health Preparedness Division, preventable diseases, and environmental health and where we are. The PPE distribution continues. We continue to get a limited supply from the state to distribute to healthcare providers. The biggest demand lately has been from dentists who had been doing emergency surgery or need a PPE moving forward. And so that's been a big target for us. We also, our emergency response team continues to support a variety of activities. They're continuing to support person to person, their food pantry and packing groceries. They're continuing to do the delivery teams. They're the drivers. Every weekday, anywhere from 30 teams to one team, they deliver groceries to the Norwalk senior populations or people who are quarantined. They also, Lamond is on the phone. There was a large food distribution a couple weeks ago at Veterans Park, and so the emergency response team also supported Lamond and others and the Connecticut Food Bank to distribute food. There was over 2,000 families. Very successful event that Lamond and his team organized with Connecticut Food Bank. They're also continue to stitch homemade masks, and they're giving them out to people who are in need of them. They also are doing outreach calls to those who need referrals or support. They're continuing to help us with translation and our contact tracing. So they've been a huge help to us. And again, it's just amazing, you know, Glenn and Donna putting that team together and all that they've been able to do and how much they've supported us. So it's been great. I see Dr. Karpiak is on as well, so we do have a quorum now. So once I finish with this part, should we go back and look at the minutes? For environmental, I'm sure you know the governor put out his executive order last week related to the enforcement of the reopen guidelines, and they've added the health departments as being one of the enforcement arms of that, and so they've defined what is a public health facility. So local health directors have the authority to enforce the sector rules related to hair salons, barbershops, beauty salons, spas, tattoo or piercing restaurants. And they've also added under to the definition of a public health to a public nuisance, any violation of the sector rules or the sector rules. And so health departments are now in inspecting and enforcing related to that. And so Tom's team, they've started an inspection program for all the outdoor dining facilities, and they're also preparing to get the hair salons and barbershops that are going to come on board to also provide guidance to them on the reopen guidelines. We're in the process of renewing all the licenses for them. And so they're working on reviewing all the outdoor dining permits, and they've come up with inspection checklists for those as well. The weights and measures program has been starting to do inspections again. And also the housing section hasn't stopped, that we've continued to receive complaints. And we set up appointments, and we're doing a lot of the exterior complaints and then doing inspections on vacant apartments. Any questions on preparedness or environmental before I move on to preventable diseases?
Terry Quell, I just had a question about the enforcement. So the Board of Health environmental staff already has a whole set of work that they do. So with this additional work, I'm just wondering how do we have the resources to do that? Do we have enough people?
So certain establishments have been closed, so like the salons aren't open yet, and so the restaurants are starting to open, the outdoor dining, and so with it in phases, we've been able to handle it. The expense and the cost is really the overtime, because we're asking them to go out on evenings when there's a lot of activity in the restaurants, because that's really where we want to see and make sure everyone is abiding by the rules and they're being safe. And it's also, of course, a learning curve for everyone too, to have these new rules and to operate in this new way. So the cost so far for us has been in the overtime.
And that's being reimbursed by that funding?
We're actually going to the city for that overtime reimbursement, because We're looking at the crisis funding to support a lot of the preparedness staff and those. And we also know that we might have, we're looking at vaccination in the future too. And so we know that some of that money has to go to those supplies. So we're looking right now at our current budget and using existing resources within the current budget. Also moving forward, we know that a lot of the big temporary events they're not going to be held. And so a lot of times our OT has been used to cover those. And so there are, there'll be some savings by that. And so that's what.
Okay, good.
Yeah. So
Great.
But yeah, again, it's the overtime in the evening and having to shift, to be able to add some. But the mayor's office is supportive of us needing to operate, when it makes the most sense for the safety of the community.
Right. Good.
Okay, so, and then I just wanted to mention preventable diseases as well. So the staff is continuing with contact tracing. And then we're also moving to this new software program called Contact CT. That's the new software program that the state is contracted with. And so staff right now are becoming familiar with that software program. We're working on building a team of core people at the health department to do contact tracing. And we've had a lot of people interested, volunteers that are interested. And so we're working, Darlene, Teresa, and Megan are developing criteria for inclusion as a volunteer contact tracer. And they're looking at training tools and developing an orientation plan. There's a couple trainings like the Johns Hopkins one and some others that we're looking into. The state has their system for enlisting volunteers, but we can also enlist people under our own umbrella, under the Norwalk Health Department. And so we're working on both. We think it's important that we have our own set as well. And so again, we're looking at current staff and figuring out who can contribute a set amount of hours to this. We had wanted to have sanitarians do some of the contact tracing, but with the enforcement, it's going to be a lot more difficult if that activity is continuing to increase, and getting through these different phases. So we'll see. But
is there an idea about how many people you will need to be doing this?
Yeah, so there's the metrics, right, that the state is looking at onboarding, between 500 to 1,000 volunteer contact tracers. But, there's the metrics. Some states have 15 per 100K. Some states have 30 per 100K. And some of it's based on the level of activity, obviously, if there's widespread community transmission versus lower case counts. So we're looking to, we're more on, like, I guess, we're not going to have like 15 full-time contact tracers. It's going to be more like part-time hours, or staff being able to, some staff will be able to do it full-time. But we're looking at, we submitted a list. Megan, I don't know if you remember the exact number of how many staff members we're having on board into the system right now. Is it 8?
Yeah, I was gonna say around 8.
I think it's 8, yeah. So just with staff, and then we're looking to at least get at minimum 10 volunteers. To this. That's our goal. But we'll see. And then we also have that state pool that we can tap into as well when we need it, when we exceed our capacity. And people are calling us and interested, and so we're writing all those names down. Once we have the system in place, we can follow up and onboard people, because part of it also is we're looking at background checks and other, things that are obviously important to do.
Yeah, Dan, it's Megan. So we're gonna be doing a lot of training with the volunteers to make sure that they're up to speed prior to starting the contact tracing. So making sure they are trained, like Deanna said, with the state system, but as well with our internal policies and procedures, so that everybody's following the same guidance.
And so the next, I just wanted to talk about, actually, can we do approval of the minutes and then we can go into just operations and like health department?
I move.
Okay. Dr. Weinberger moves. Do I have a second for moving the minutes?
Second.
Terry. All in favor? Or any questions, comments? All
Nope.
in favor?
Hi.
All right, thank you all. Okay, so let's talk about the health department. So the mayor has his reopen plan that has the same phases as the governor's. So it mirrors the state plan in terms of the phases. And so right now we're in phase 1. And if looking at city hall operations, which, we fall under the same umbrella, we're not looking at, we're still being, our doors are still closed to the public at this point. People aren't walking into the building. WIC still is operating remotely. Clients aren't coming in person for appointments. Our clinics are not operating. We don't have our travel and adult immunization clinic. We don't have the childhood IZ running. And we're not looking for actual people coming in the building by appointment only until phase 3. So we're still a ways to go before we start thinking about that. But I know what our priority that we've talked about for starting to bring back some of the clinics has been the sexual health clinic. We've talked just about with that with Darlene and Shima and Lamond, and we feel like that's, in terms of all the clinic operations, that's the priority for us. So that's what we've been thinking about, is how can we operate that clinic in a safe manner moving forward, making sure we have all the PPE, and also the staffing to support that. So related to the staffing, Shima is now, she's our nurse practitioner. She's working part-time now. And so we've had discussions with Lamond about, she used to be a full-time nurse practitioner, but we really need a full-time public health nurse, because Shima is part-time. If she's supporting some of the clinical operations moving forward with the contact tracing and all the public health nursing needs, we have Darlene has been doing so much. She's our full-time nurse right now. And so we're looking at the budget, because we have money in the part-time preventable disease line item, and we have money in the full-time disease preventable disease staffing line item. So we want to bring back a full-time public health nurse to work with Darlene and to work with Shima. And so I wanted to let you guys know that that's what we're thinking, and wanted to hear your thoughts on that as well.
I think it's very important to have that.
Okay.
And
Terry,
I
what do you
second
think?
that.
I agree. I agree. I think we've been working for a long time with excellent resources, but not enough nursing staff.
Mhm.
So I think it's a great idea.
Okay. The other thing related to the clinics we've been looking at is, Corey was our part-time lab tech. You remember we had Al Kao was our lab director. When he left, we went to a part-time lab tech to work with Pat in the lab. She left to go to take a full-time position. And so that position is vacant right now. And we've been actually rethinking that position and thinking it would make more sense to have that position be more like a medical assistant position to really support Shima in the clinic, so that she can operate to her full license, operate to the highest extent of her license, rather than doing some of the other tasks that a medical assistant could do. And then also have that medical assistant support, the lab as well. So be able to do both, but really focus more on a medical assistant rather than the lab capacity. So, we're using this as an opportunity to really look at our clinics and think about, what we should be doing moving forward and how we can really operate in the most efficient way.
In talking about the clinics, there's obviously been a huge discussion about kids not getting their regular vaccines.
Mhm.
Where is that?
So we actually, we're looking at, and also related to the school physicals too, it all sort of links with the childhood IZ. And so we're looking at getting a group together with Lamond, all the, different players in that, to really look at that all and plan for that moving forward, both the school physicals and the childhood immunizations.
Good. Okay.
And we know that, the community health centers continue to see children for their well, for immunizations. But yeah, that's something that Pam Bates, our immunization action plan coordinator, is very aware of and trying to get the word out and about that. So that's definitely a priority as well. But we're looking at more as trying to connect children to immunizations rather than the health department at this time providing immunization, giving our limited staffing and really needing to focus on COVID-19. Do you agree that that's a good approach?
Oh, I think it's absolutely, particularly with the community health center. I think that, we're doing the same thing. We're trying to get kids into the community health center for as a medical home, not just to get vaccines.
Yes. And that's really the way it should be. That's where we should be, moving. Okay, so that's related to some of the changes that we're looking at with the clinics moving forward. And I've also asked Pat to take a really good look at the travel and adult immunization clinic, to look at, that was a clinic that was always, a revenue generator for the city. But so I'm really questioning, well, is that still true with where we are right now? And so we're going to be doing a thorough analysis of that, so we can determine, what are the resources that we're putting into this, and what are we getting out of it? Because I think our focus really needs to be on sexual health, tuberculosis, obviously COVID right now. So in terms of bringing clinics back, that's sort of on the lower list of the priorities, from where the staff and what we're thinking in terms of, the different clinics. So we're looking at that as well. And then the other big thing is flu, because we think there's going to be a huge demand for flu vaccine this year. And so we're planning for that as well. We're looking at different models. We're looking at, Glenn is looking at, drive-through models. We're also looking at, can we partner with the different health departments in the region on flu vaccination? Can we pool our resources together for it? So all those discussions are happening right now. But that's another big thing that we're going to need to prepare for, is the fall flu vaccination. Okay, so I also wanted to talk about the data analysis and the epi and the surveillance piece. So there have been a lot of requests from different people about different data analysis, looking at providing more thorough, and to be honest, I've been the one doing it because we don't have an epidemiologist on staff. And so we're also looking at that to see, moving forward, we're in the middle of a pandemic. We're fearful what if in the fall it comes back and it comes back, it's still here. If it is worse in the fall, we really need to be staying on monitoring it, continuing to improve the contact tracing and the epi and the disease surveillance and the communicable disease control. And so I think having an epidemiologist would be a big asset to us, and something that's really crucial at this time. And so we're also looking at that. I've been having discussions with Lamont about that, filling that gap, because I feel like that's one area that could be a lot better right now, is that epi surveillance piece. And so I also wanted to talk to you guys about that too, if you agree about that, or what your thoughts are on that.
I think this all falls into the fact that we have to increase the support for public health, and cutting corners and having you do 9 different jobs moving forward is going to be a disaster for the community. So I think we have to look at, not to have an epidemiologist right now is not good public health.
Thank you. So you're in support.
I agree with Dr. Weinberger. I think it would be an excellent idea. Yeah.
And I agree as well. We really are at a deficit right now, and this isn't going away for the next couple of years as a minimum, and who knows what else is lurking out there. We've really been at a deficit from the get-go to not have an epidemiologist involved.
Thank you all. Yeah, so to me, like when you look at resources, to me, that's the number one, I think, that we need right now. And then we're also looking at just the contact tracing too, the resources to support that. But I feel like the epi can help support that too.
My concern would be, how are you going to find one now? Probably everybody is looking for them. So I think they're going to be at a real premium. And I don't think there's a lot of them out there that are available. So that would probably be the biggest challenge.
Yeah, I know. So I was looking at job postings in New York is looking for them. I haven't seen many postings in Connecticut though, in terms of health departments,
Good.
Local. So yeah.
Okay.
But yeah, I think you're right.
And who do you know, like at Yale, because they're putting these people out into the field.
That's true. Yeah. Yeah, we have a lot of connections to the different universities and the schools through different like research projects where we partner with. So that's sure that would be the first place that we would be looking at. Yeah. Yeah, it's May, right? People are graduating, so it's a good time to grab one.
Yeah, they're graduating at the beach.
So those are the big topics that I wanted to talk about with you today and get your feedback and thoughts on. Do you have any other questions or any other recommendations, thoughts before we wrap up? All right. Well, thank you all
Thank
very
you.
much.
Thank you.
Thanks to you and all the staff for all your hard work.
Thank you, Terry. Thank you all.
All
Yeah,
right.
my health department staff is really great.
They've
We
got
had a
great
staff
leader.
meeting on Zoom last week. We had, about 30 of us on there, and it was so great to talk to them all. And yeah, they're doing a phenomenal job.
All right, guys, have a good day.
Have a good day.
You
Bye.
too. Bye-bye.
Bye.